I'm Aileen McGloin. I'm the Director of Nutrition at Safefood, and I'm going to be your chair this morning. You are so welcome to our annual Food Poverty Network meeting, and we have some really exciting presentations ahead. I, of course, have a little bit of housekeeping to go through before we get started. Just note that the event is being recorded, so for whether you registered online or in person, you will receive a link to the recording within about 2 weeks of the event. We very much welcome participation and questions during the event. If you are in the room, we would ask you to wait until the mic gets to you, because if you don't, the members who are online won't be able to hear your questions. And if you're online, please use the Q&A box on your screen. There's a second chat box, and you can use that for technical issues if they do arise. We will be answering questions during a panel discussion session at the end, unless we find we have some small gaps and can ask our speakers a few questions as we go along. And as usual, we very much encourage you to discuss and highlight some of the content from the event on social media. So whatever channels you're using, please use the hashtag food poverty. So just hashtag food poverty. So moving into today's theme, across the island of Ireland, we're now witnessing a real shift in how food is shared and how food and communities are supported in relation to food. We have innovation models like food clubs, like community pantries, like student pantries, and of course the social supermarkets that will be discussed later today. And these are transforming the landscape, moving way beyond where we have traditionally been in the realm of food banks. So today we are delighted to welcome a lovely panel of experts, and they're going to discuss the following: the move away from the traditional food bank model, real life examples of community food sharing, best practice for developing and running social supermarkets, and how we can support organisation to build sustainable and scalable surplus food programmes. And this is more than just a conversation around food. It's about how we offer more dignity, sustainability, and community-led approaches in how we address food poverty. And we're really pleased that you're all part of this conversation today. Now, if you indulge me for a moment, of course, there's no such thing as a free lunch. So we're going to get you to participate a little bit at the beginning. Most of you will be familiar with an online tool called menti.com. So if you have your phone there, please keep that on silent, but go to menti.com on your browser. When you do that, you will be asked to insert the code that you're now seeing on your screens. And we only have 2 questions for you this morning. The first is, people are very quick. I can see the answers already on screen. What one word or phrase comes to mind when you think about novel approaches to food support? So I'll just give a few seconds for that word cloud to build. Some real positivity coming through there. Wow, okay. So very clearly, innovation, dignity as the most dominant phrase, community and empowerment are coming through, and sustainability and support joining them there as more people insert their words. Really lovely. We'll be able to hang on to that. Thank you very much. And question 2, we want to gauge your understanding, your perceived understanding at the beginning of the end of the event. So we'll ask these 2 questions now and later. And the question is, how do you perceive your understanding of novel approaches? I'm very familiar. I've heard of them, but don't know how much about them or how they work. I'm aware of traditional food banks, but not the more novel approaches. And this is all new to me. Okay, again, we're beginning to build some data there. And while there's quite a range, most people have heard of them but don't know much about how they work. So that's great for a starting point for today. That's super. Thank you so much for doing that. We are going to move on to our novel approaches content later, but you'll have seen from your agenda that we're also going to take this opportunity to launch our food basket research. So this is research that we carry out every 2 years alongside our partners, the Food Standards Agency in Northern Ireland and the Consumer Council in Northern Ireland. And the food basket research presents the cost of the minimum essential food basket. We are happy to be joined by Robert Thornton this morning. You're very welcome, Robert. Robert leads the Vincentian MESL Research Centre at the St. Vincent de Paul. He's been working on the minimum essential standard of living research since 2010. His work is focused on the expansion of budget standards research in Ireland, assessing income adequacy, policy analysis, and informing evidence-based recommendations. He has a particular research interest in income adequacy and approaches to measuring poverty and social exclusion. This morning, Robert will be sharing his latest findings from Safefood, the cost of a minimum healthy food basket research. And the presentation will give a summary of the findings for Ireland and Northern Ireland, highlighting food costs for 2024 for different household types. He will illustrate how costs vary by child age group and examine food costs in proportion to income from social welfare and when in employment. So you're very welcome, Robert.
Thanks, Aileen. Good morning, everyone. So today I'm going to talk about our latest edition in our series of reports on minimum food costs in Ireland and Northern Ireland. To start, I'll just give some background on our minimum standards research. Then I'll go on to look at some of the key findings on minimum food costs and also look at the burden of food costs on low-income households, comparing the cost of the minimum healthy food basket to social welfare and state benefits in Ireland and Northern Ireland. So the minimum essential standard of living, our MESL research, sets out to answer a simple question: what do people need to be able to live with dignity? And there's a number of ways researchers try to answer this type of question. Some use proportion of average earnings as an indication of whether people have enough. Some draw on surveys of what people spend, but approaches like this don't tell us what people need and what's done without, because what people can afford doesn't actually equal what people need. Other approaches draw on expert opinion to determine what's required, but this doesn't include the lived experience of what people need. So to answer this question, we use the consensual budget standards method. This method's been in use in Ireland for the last 20 years. It's also used in the UK, other countries around Europe, and other parts of the world. And it comes from the perspective that the best people to ask are people living in this situation themselves. So with the consensual budget standards method, people with relevant lived experience are the experts to answer the question. And in the research, we bring members of the public together from different backgrounds in deliberative focus groups. Groups work together to come to agreement on all the goods and services that are needed to have a socially acceptable minimum standard of living that lets individuals and households live with dignity and participate in society. So we do this through multiple stages of in-depth discussions. Multiple groups meet, each building on the work of the previous group to refine and produce a final consensus on what people agree is essential. The research places an emphasis on needs, not wants, and we produce itemised, detailed lists detailing the full range of goods and services that are agreed as required. The group discussions to establish this MESL basket go through a range of different categories, carefully considering needs and how needs should be met. They look at the different products and services that are required, level of quality, and so on. Where necessary, we'll deliberate on what's a need to have versus a nice to have. And the groups work from this shared understanding of minimum, referring back to the definition on the screen, that a minimum essential standard of living includes physical needs such as food, shelter, and warmth, but it's also about having what you need in order to live and take part in society. So the focus is on establishing needs, not wants, and compiling this comprehensive list of goods and services that are required to meet these needs. And so our minimum baskets cover a range of minimum needs, not just for survival, but enough for people to participate in society and live with dignity. The baskets are comprehensive and wide-ranging, and through the deliberations, the participants discuss everything from socks to Wi-Fi, detailing all the goods and services that are needed to enable this acceptable standard of living. Every year, we update the cost of the basket and produce a report detailing the overall change in minimum living costs. But every 2 years, in conjunction with Safefood, we look in detail at the food aspect of our research and produce reports examining minimum food costs for 6 household compositions in Ireland and 4 in Northern Ireland. And today, I'm going to look at the findings for the 2024 reports. So looking at Ireland first, the research examines the cost of this minimum essential standard of living healthy food basket for 2024 and the change in costs since the previous report in 2022. The MESL baskets for Ireland were repriced in this period, so these results are based on actual prices in the first quarter of 2024. So in the 2 years from 2022 to 2024, average food costs as measured by the Consumer Price Index rose by 16.1%. The cost of the minimum healthy food basket as measured in the MESL rose by 22.7% in those 2 years. So the minimum basket is more focused on staples such as meat, fruit and vegetables, whereas the standard inflation basket used in the Consumer Price Index gives proportionately less weight to these staples. And what this means is that changes in basic items have a bigger impact on the cost of the minimum food basket than the standard food inflation measure would predict. For instance, the cost of most of the fruit and vegetables in our MESL basket increased in this period. For example, the price of a cauliflower rose by 13% in the 2 years we were looking at, and it's up 31% since 2020. And changes such as these have a more marked impact on the MESL basket than the average inflation basket. Food needs are also multidimensional, and the MESL baskets are based on nutritionally balanced weekly meal plans. Through the deliberative group process, people agree on the range of acceptable meals and snack options, balancing needs for health, convenience and cost. These options are reviewed by a nutritionist and the final basket is agreed. So in addition to normal day-to-day eating, there are other social aspects of food are also included. So for working age people and families, there's an occasional takeaway, but as a treat, so there's an occasional takeaway, but as a treat and as a break from cooking. Teenage children, the basket includes buying lunch at a deli counter once a week for a sense of inclusion and independence. For older people, there's an allowance for extra food for visitors to be able to offer someone like cake or biscuits. And every household food basket also includes an allowance for extra food at Christmas. This both includes buying extra for Christmas dinner and also seasonal treats like a selection box for children. All of these provisions ensure that the social and cultural aspects of food are included in the basket. And this is on the basis that households should have the opportunity and choice to participate in activities considered a normal part of everyday life. So here we have the results for a set of households in Ireland in 2024. This is the average food cost of food per week for 6 urban household types. And so it ranges from €60 per week for a working age single adult to €187 a week for a 2-parent household with 2 children. That's at primary and second level age. And in the research, we looked at children of different age groups. And we find that the costs are highest for second level age children. At over €60 a week, their minimum food costs are approximately 50% higher than at primary school age. So we also assessed the proportion of income needed to meet the minimum food costs. Here we look at a social welfare scenario, but the full report also examines employed situations. We find that households with younger children would need to spend slightly over a quarter of their social welfare income to meet the cost of the minimum food basket. And for households with an older child, this rises to 33%. In all cases, this is an increase in the proportion of income needed to meet the minimum food costs compared to 2022. Looking then at Northern Ireland, we examined the costs for 4 household types in 2024. In the 2024 report, the food costs are based on new consensual budget standards research, which is carried out by the Minimum Income Standard team at the Centre for Research and Social Policy in the University of Loughborough. This research uses the same method as the MESL in Ireland, and similarly establishes detailed minimum need baskets for households in Britain and Northern Ireland. The MIS provides up-to-date baskets for examining the minimum food cost in Northern Ireland and now provides the basis for this report. So in the 2 years from 2022 to 2024, average food costs, again as measured by the Consumer Price Index, rose by 23% for Northern Ireland. But again, the Northern Ireland minimum basket is more focused on staples, with fruit and vegetables making up 36% of the basket and meat and fish making up 16%. And once again, the social aspects of food are also a significant part of the minimum basket for Northern Ireland. So they again include the opportunity for households to have an occasional takeaway, for single people to share food with people from outside their household, and for seasonal celebrations such as Christmas to be marked with an allowance for additional food at this time. Including these aspects of food ensures that the minimum food basket is based on lived experience and recognises that while food is of course necessary for survival, there's also cultural and social dimensions to food. So here we see the average cost of food per week for 4 household types in Northern Ireland in 2024. So it ranges from £71 a week for an older person living alone to £276 a week for a 2-parent household with 3 children. They're of preschool, primary and second level age. And this again indicates that food costs are highest for households with older children. We also assess the proportion of income needed to meet minimum food costs. Here we look at the state benefit scenario, and the full report also examines employed situations. So our analysis shows that costs of the agreed minimum food for an older person would equate to 30% of income when in receipt of the state pension. But for households with an older child, this would rise to 63% of state benefits income when out of work. And in all cases, we find that food costs have increased at a greater rate than income supports from 2022 to 2024. So, to conclude, the research establishes the cost of a socially agreed minimum acceptable food basket for a range of household compositions in Ireland and Northern Ireland. We consistently found that the cost of the food basket equates to a significant proportion of household income when dependent on social welfare or in low-paid employment, and this is especially the case for households with older children where food costs are highest. But the research also shines a light on the challenge of trying to balance the cost of a healthy food basket in the context of meeting other needs and expenses when on a low or inadequate income. And in reality, households may be pushed to forgo a healthy diet given other competing demands on their limited income. I believe the 2 reports are available online at those links. Thank you.
Yes, I'm going to.
Yep, sure.
We have just a couple of minutes if anybody has a quick question for Robert. Not seen any online. One question I had, Robert, if that's okay. The costs for the families with older children were quite extraordinary. Could you unpack a little bit the differences there? I know you're more or less feeding 4 adults, but is there anything else you'd like to point out?
Yeah, I think it's a large chunk of it is that element of it's effectively it's another adult in the household, but income supports don't treat an older child as another adult, so the cost goes up, the income doesn't go up as proportionately. There's also things like there's that social aspect and independence aspect. So as I was saying, for Ireland, the teenage basket includes that kind of deli lunch once a week, which isn't very significant, but it's important. And when we talk to groups of parents, they tell us about how this is important for some sort of sense of social inclusion, that they see all their peers doing it, they should be able to do it too, and also kind of a sense of independence. They're going to a shop, they're buying the thing themselves. It's not just they're being handed packed lunch in the morning. These kind of factors just add up to make the basket that bit more expensive compared to their younger siblings.
Thank you. Great. Do you have another further question yet?
Yes, so I believe consideration given sibling.
Mike, boy.
Oh, we therapy.
Sorry.
During begin to necessity during more service stuff based like the stash and cash burns.
So the question relates to service accommodation and people seeking international protection. Are the differences there?
That's not something we look at in this research. We have done some research previously looking at people in the international protection system. So certainly there would be differences. A couple of years ago we produced that report. I couldn't tell you now off the top of my head, unfortunately, where those differences lie, but you're right, there would be differences.
Thank you, Robert. We'll leave it there. Thank you.
Thanks.